Assalamu alaikum. Good day, everyone. First of all, let me thank Ms. Serju for giving me this opportunity to do a little presentation for you on breast cancer awareness. October is Breast Cancer Awareness Month, and almost exactly 2 years ago, I would have started my own breast cancer journey. I recall clearly my doctor saying to me that breast cancer is the most researchable and treatable form of cancer. I've also come to realize that early detection is key to having the best possible outcomes. I'd like to share now just a few slides with you. Okay, so the purpose of this session is not to freak you out, not to get you scared, but to empower you by giving you the information to help yourself and others. At this stage, you're all teenagers, changes, lumps are normal, and especially during the time of your period. Having breast cancer for you right now is very, very, very low risk. So at this stage, it's just important to learn as much as possible and share what you learn with your mommy, your aunties, grannies. And of course, it's about knowing your own body. If you notice changes that are unusual, it's important to check up on it. At this stage, having something called fibroadenomas and fibrocystic changes are totally normal. Those are lumps that move around, or you have some thickness, fluid-filled sacs called cysts. These are totally, totally normal for you. So what do you look out for? You look out for things that are abnormal, that are not normal for your body. A nipple that turns inward or nipple discharge, lumps that don't go away well, regardless of whether you're in your period or not, swollen lymph nodes under the arm or near the collarbone, breast pain that is not related to your period, changes in your skin, redness, swelling, dry or flaky, thick, itchy rash or puckering, changes in the size and shape. So how would you know these things? The only way you'd know what is normal for you is if you are self-aware. So I'm going to share a recording video now that would help to explain how to do a breast self-exam.
All women are at risk of getting breast cancer, and the chances of developing it increase with age. But we also know that early detection can save lives. Using our Mochi friend as a stand-in for the breast, we will demonstrate how to perform a breast self-examination, or BSE. Breast self-examination is easy when you follow TLC. Touch, look, check. Touch your breasts. Begin by lying on your back and place your right hand behind your head. With the pads of your middle, index, and ring fingers of your left hand, gently and firmly press in small circular motions to examine the entire right breast. Gently squeeze the nipple as well, checking for any discharge. Next, sit or stand and feel your armpit and collarbone as breast tissue extends to those areas. Repeat both processes on the left breast. Look for changes. Stand in front of a mirror with your arms by your side. Look at your breast directly and in the mirror. Take note of the shape and outline of each breast. More importantly, look out for these signs of breast cancer. Changes in the skin such as a rash or an orange peel-like texture, lumps and swelling around the breast, the nipple turning inwards or bloody discharge from the nipple, dimpling or unusual pain around the breast. Repeat the process with your arms raised above your head. Check with your doctor. If you notice any changes or anything new in consecutive self-examinations, highlight them to your healthcare provider as soon as possible. They will then advise you on the next steps. Just a few minutes of BSE each month can save lives and breasts. If you're menstruating, do the BSE 7 to 10 days after the start of your period. For women who have stopped menstruating, do your BSE once every month on a regular date. BSE should also always be coupled with regular mammogram screenings appropriate for your age group. Help spread the word to all the women you love and encourage them to take precautions suitable for their age.
Okay, so in addition to being self-aware, knowing what is normal for your body, you should try to maintain a healthy weight through proper diet and exercise. Don't drink, don't smoke. And starting from the age of around 25, you can start getting clinical breast exams done by a doctor. You should keep in mind if your risk factors. So just know that if you have a family history of cancer, it means that you are more at risk. Women at starting at the age of 40, they should be getting annual mammograms done. So take care of yourself, take care of your loved ones, and let's do everything in our power to stay healthy. Assalamu alaikum. Take care, everybody.